Alicia Moden. I'm a nursing student at the University of South Alabama, and I'm going to be doing my medication administration checkoff. So first, I will have my cameraman scan the room. And this is going to be my assistant that I show my injection sites on. So the first thing that I'm going to do is I'm going to take a look at my order form and my MAR, and I'm just going to compare everything and make sure that I have all the right stuff. So Jaguar Jones, date of birth, August 25th, 1963, August 25th, 1963, allergic to penicillin. And I see that the order is heparin 5,000 units subcutaneously every 12 hours. Heparin 5,000 units subcutaneously every 12 hours. So now I'm going to go into the medication room and I'm going to perform hand hygiene. And I'm going to locate my heparin. And I have heparin 10,000 units per milliliter, and the expiration date is December 5th, 2025, so I know that it's not expired. And I'm just going to take my vial and I'm going to compare it to my order form and my MAR to make sure. So heparin 10,000 units, heparin 5,000 units subcutaneously every 12 hours, heparin 5,000 units subcutaneously every 12 hours. So I know that since this is for 10,000 units, I know that I will be giving 0.5 milliliters once I get my syringe. And I'm going to be using my 1 milliliter tuberculin safety syringe. So first thing I'm going to do is I don't have any alcohol pads, so this is what I'm using, but this is going to be my alcohol pad. And I'm going to wipe off my vial, and I'm going to throw that in the trash. And I'm going to use tuberculin safety syringe. So first thing is I'm going to uncap, I'm going to just lay it, and I'm going to get 0.5 milliliters of air. So there we have it, 0.5. Okay, and I'm going to insert it into my heparin. Going to push all of my air in. Pull out my heparin, and I'm going to pull out a little extra to get rid of any air bubbles that I have. Okay, and get up to 0.5 there, and I see that I am at 0.5 with no air bubbles, and you can see there 0.5. So now have it ready, and I'm just going to recap the lead. And I'm just going to check one more time. 0.5 milliliters, heparin 5,000 units subcutaneously every 12 hours. Heparin 5,000 units subcutaneously every 12 hours. So I'm going to take this over to another nurse, and I'm just going to let her check it and make sure that everything is correct. And she said that everything was good, so now I'm going to take a piece of tape, and I don't have any tape today either, so I'm going to use a Band-Aid to use as my tape. And on the tape, I will write the medication, the dose, and the patient name. So I'm going to write heparin, 0.5 milliliters, 12 hours. And I'm going to put Jaguar Jones, August 25th, 1963. And now I am ready to enter my patient's room. But before I go in, I would just go over to my assistant and show you all where I would insert my injections. And so for subcutaneously, what I will be doing on my patient, I will be doing in the abdomen. So you would locate the umbilicus, which is hers is here. I want to pull her shirt up, but it's going to be 2 inches to the left or to the right of the umbilicus here for subcutaneous. And it can also go on the dorsal portion of the back of her arm here, right here, in this area up 3 fingers from the elbow, right there in that area. And it can also be in the anterior portion of the thigh. And for an intramuscular, I could do the vastus lateralis, and for that I would locate the greater trochanter and the knee, and it would be in between this area. I'm going to go down the midline of the anterior portion and the midline of the lateral portion. So right in this little area is where it would go. And then for ventrogluteal, for intramuscular, I would locate the greater trochanter. Once again, oh, I'm sorry, and then I would have my thumb pointing towards her abdomen, and I would have my index finger going towards the anterior superior iliac spine, and my middle finger going towards the iliac crest, and right in between that V is where it would go. And then for the deltoid, I would locate the amacrine process, and I would go, okay, the amacrine process, and then I would go 3 fingers down from that, here. So right in between that V is where it would go. And those are my injection sites. So I'm now entering into the patient's room. I'm going to perform hand hygiene, tell them who I am, and that I'm about to administer heparin for the blood clots. And I'm just going to check one more time now that I'm here. And I'm going to look at the armband and see that it is Jaguar Jones. And on my MAR, Jaguar Jones. And on my order form, Jaguar Jones, date of birth, August 25th, 1963. August 25th, 1963. August 25th, 1963. He's allergic to penicillin, and allergic to penicillin. And I'm going to check one more time. Heparin, 5,000 units subcutaneously every 12 hours. Heparin, 5,000 units subcutaneously every 12 hours. And I do have 0.5 milliliters in here. So once I have did hand hygiene and everything like that and let him know, I will just raise the bed up to working level and lower the side rails. Put on my goggles and my gloves, and I'll be ready. So for subcutaneous, I'm going to be pinching the skin. And once again, I did not have any alcohol wipes, so I'll be using these over here. So I would just wipe down the insertion site, and I would just throw that away. And I would pinch the skin and go in at a 90-degree angle here. And I would administer my 0.5 milliliters. Over the skin, and we're done. And then I would just dispose of that in the sharps container, and I would lower the bed and raise the side rails for him. And then once I leave and head back to the nurse's station, I'm going to make sure that I'm documenting if he's having any allergies or anything like that, and I'm going to make sure that I document everything good. Before I leave, I'm gonna also take off my gloves and then take off my goggles. And that completes my checkoff.